We offer a service to patients who are referred in by their GP. They will be usually seen by the consultant endocrinologist first, within a month or sooner if required. Most of it involves care for people with diabetes, type 1, type 2 diabetes and other secondary forms of diabetes. There's also a large part of it is involved in dealing with people with thyroid disorders, overactive thyroid, underactive thyroid, thyroid nodules. Diabetes in particular is a very common condition. There's a huge amount of people affected by it, and there's a lot of people out there who need help in terms of managing their own diabetes so that they can live healthier lives and live longer, essentially.
The role of the diabetes nurse specialist is to educate patients so they become independent in the management of diabetes and improve their health outcomes. What that essentially means is educating the patient, supporting them, giving them dietary advice, helping them to take their medication safely.
With type 2 diabetes, I suppose the majority of people are overweight. So a key part of treatment is weight loss and weight management. And what we would be trying to do is try to assist the individual to make positive lifestyle choices and set and achieve realistic goals for themselves.
It's one of the key things that we strive to achieve here within our service is patient empowerment. So we feel it's very important that an individual patient knows about their own diabetes and about their treatment in order to maximise that treatment and to be successful.
You have a lot of time educating patients and empowering them to do the best that they can do for themselves. It's a very common problem at the moment, and diabetes is definitely on the increase worldwide. So it's a position where I think nurses make a significant difference because it's about empowering patients.
One of the particular advantages we have here is the continuity of care, whereby people can come back and see the same person each time, but also access. People can be seen quickly if there's a problem. So if a patient has a problem that they're on, for example, a tablet like steroids, or they've got a chest infection, their sugars have gone very high, they can pick up the phone, meet with a diabetes nurse specialist the same day. I speak with a diabetes nurse specialist on a daily basis, and we have a weekly meeting to go through all the patients who've had an interaction the previous week, and we can coordinate things that way. So another common one would be thyroid disease. So the thyroid is a butterfly-shaped gland in the front of the neck, and it releases hormones that are involved in the control of a number of processes within the body. This would broadly be termed metabolism. So diseases of the thyroid gland are quite common, particularly in underactive thyroid called hypothyroidism. The other condition would be the opposite of that, an overactive thyroid, hyperthyroidism. And there can also be a thing called thyroid nodules, which are usually benign, little lumps within the thyroid gland. These may be picked up if someone feels a lump, or if someone sees the neck being swollen, or they could be picked up if someone has a scan done for the chest for another reason. So the majority of these are benign, don't cause any problems, but a very small minority can be cancerous. So these are things that need to be monitored, and we have a thyroid multidisciplinary team here involving the endocrinologist, the radiologist, pathologist and thyroid surgeon. And usually if someone has a nodule, we'll do a number of tests, blood tests, scans of the neck. They might need a sample taken from the nodule in the neck. We discuss that at our multidisciplinary meeting, and we come up with an individualised care plan which is agreed with the patient. So certainly since I've come here, I've been very gratified by the fact that we've been able to really build the service here, make it a very functional service, and we've got a lot of really good feedback from people who've been coming to see us here about the difference it's made to their lives, and that's what it's all about.